They say AI is coming for our jobs, that machines will soon be smarter, faster, and more accurate than any human. And for pharmacists, that threat can feel incredibly real. AI can already flag drug interactions in milliseconds, manage inventory with perfect precision, and some can even pass pharmacy board exams. We see headlines that AI is generating billions for pharmaceutical industries and robotic systems that can dramatically reduce medication errors. So, is this really the end of the neighborhood pharmacist? The end of that trusted expert you turn to for advice? Nope. In fact, it's the opposite. That fear is based on a fundamental misunderstanding of what a pharmacist actually does. The future isn't about replacement, it's about a massive promotion. And this technology isn't a threat, it is the single biggest opportunity for pharmacists to become more essential than ever. All right, let's get one thing straight. That tedious, repetitive part of the job, yeah, AI is coming for those. And thank God, actually. For decades, the images of pharmacists has been someone behind the counter counting pills and sticking on labels, but that's just a teeny fraction of their training and expertise. A huge chunk of their day is eaten up by administrative and logistical tasks that, while are necessary, don't actually require a doctor or pharmacy degree. Think about the endless cycle of managing inventory. Traditionally, that means manually tracking stocks, trying to predict seasonal needs and placing orders. Now, AI algorithms can predict medication usage patterns, manage stock levels in real time, and reorder supplies automatically. For example, AI-driven platforms from companies like Leafio AI and Shipsy are designed to do exactly this, helping pharmacy chains organize and optimize their stock across hundreds of locations. These systems analyze health trends so the pharmacy doesn't run out of flu shots right as the season starts to kick off. And then there's the administrative black hole of insurance claims and dreaded prior authorizations. It is a nightmare. AI can read insurance plan rules, suggest covered alternatives, and even auto-populate the dreaded paperwork that causes so many delays. Automated systems are already cutting down prescription processing time, in some cases, by as much as 50%. This isn't about replacing the pharmacist, it's about clearing their plate. These are the very tasks that lead to burnout and steal time away from the most critical parts of the job, the patient. By automating these repetitive processes, AI gives pharmacists back their time. It's handing them a powerful tool to handle the machine work so they can finally focus on the human work. So with all this freed up time, what will pharmacists be actually doing? This is where it gets really cool and exciting. We're seeing a shift from dispenser to clinical expert. AI is becoming a powerful co-pilot, a clinical decision support system that boosts, rather than replaces, the pharmacist's own expertise. Imagine a pharmacist trying to review a patient's complicated medical history with dozens of prescriptions, lab results, and notes from multiple doctors. It is a monumental task for any human. Now, imagine an AI that scans and analyzes all of that in seconds. It can flag potential drug-drug interactions, identify allergies, and even prioritize high-risk prescriptions that need a second look. AI provides the data, but the pharmacist provides the judgment. It's the pharmacist who takes that information and applies it to the context of a real person's life. This synergy is pushing pharmacy into a new hyper-personalized frontier, pharmacogenomics. That's the study of how your specific genes affect your responses to drugs. For years, medicine has used a one-size-fits-all approach, but we've all heard stories of someone who had a terrible reaction to a standard medication or a drug that just didn't work for them. Pharmacogenomics explains why. When you combine AI with this genetic data, it is a game changer. AI algorithms can analyze a patient's genetic profile to help them predict which medications will be most effective and which ones could cause the most harm and side effects before they even take their first dose. The pharmacist is the perfect person to interpret these insights, transforming their role into a highly specialized consultant. They become the expert who can advise the doctor, such as, for this patient, based on their genetic markers, drug A is likely to be useless and cause harm, while drug B should work perfectly with fewer side effects. This isn't just dispensing pills, it's a high-level, data-driven, personalized medicine. If you believe in a future where technology and human expertise combine to create a better healthcare, do do me a favor and hit that subscribe button. We are here to explore how innovations like AI are reshaping our world for the better. So AI can handle logistics and analyze data at a superhuman scale, but that brings us to the core of the argument. The one thing that guarantees the pharmacist remains essential: the human element. A tool is just a tool. It is no replacement for the nuanced, empathetic, and ethical judgment at the very heart of healthcare. An algorithm can cross-reference a million data points, but it can't look the patient in the eye and see the subtle hesitation that they show when they're scared to take a new medication. A machine can list side effects, but it can't offer a word of reassurance to an anxious parent giving their child a medicine for the first time. AI lacks emotional intelligence, cultural awareness, and the ability to build trust, all things that are fundamental to effective patient care. When a patient is confused about a complex treatment plan, it is the pharmacist's ability to listen and communicate clearly that makes all the difference. Now consider this. An elderly patient walks in with a new prescription for a blood thinner. The AI system has already flagged the potential drug interaction with another one of her meds. It's done its job perfectly. But the pharmacist, in conversation, notices the patient seems confused and mentions that they sometimes forget their pills. They also express concern about the cost. An AI sees data points. A human pharmacist sees the whole person. They can then talk to the patient about how important it is to take the medicine correctly, help them set up a pill organizer, and work with their doctor to find a more affordable alternative. That intervention is based on empathy, observation, and real-world problem solving, and it is something that no machine can replace. It's in these uniquely human moments that a pharmacist's true value shines. They are the most accessible healthcare providers in the community, and that human connection is their superpower. So what does the pharmacist of the future actually look like? Forget the old image of someone locked away behind the counter. The pharmacist of 2030 is out front, working directly with patients as a clinical strategist. Their day-to-day work will be completely different. Routine dispensing will be handled and automated by systems overseen by pharmacy technicians. The pharmacists will spend most of their time in direct patient care. They'll lead medication management sessions, help people manage chronic diseases like diabetes and hypertension, and work as part of the core healthcare team right alongside doctors and nurses. This evolution will create entirely new career paths. We'll see the rise of AI pharmacy specialists or medical data science liaison pharmacists who are the expert in both tech and clinical practice. They'll be the ones who help develop and validate the AI systems being used, making sure they're fair, unbiased, and effective. They'll essentially become algorithm auditors. This isn't a story about becoming obsolete. It's a story about evolution. The profession is moving from a task-based role to a knowledge-based one. Just as pilots still fly commercial airlines even with an autopilot, pharmacists will command the powerful AI tools at their disposal. The AI is a co-pilot handling the complex calculations and data crunching, which frees up the human pharmacist to focus on strategic decisions, the patient relationship, and the ultimate responsibility of care. The narrative that AI will replace professionals is compelling, but it's often incomplete. And in the case of pharmacy, it's just plain wrong. Artificial intelligence won't replace pharmacists. It will liberate them. It will finally take over the robotic administrative tasks that have burdened the profession for years and empower pharmacists to operate at the very top of their clinical training and license. The future of pharmacy isn't a world without pharmacists. It's a world where pharmacists are more involved in patient care than ever. They'll shift from being medication dispensers to being true medication experts and clinical counselors. Technology won't erase the need for the human touch. It will make it even more important. The profession isn't facing extinction, it's facing the most exciting evolution yet. The pharmacists who embrace these tools and lean into the irreplaceable human skills of empathy and judgment won't just survive. They'll become the cornerstones of a smarter, better, and more human healthcare system. What are your thoughts on AI in healthcare? Do you see it as more of an opportunity or a threat? Share your perspective in the comments below. We read each one. Thank you for watching, and please don't forget to like and subscribe.